Hi, everyone. My name is Stephanie Bultema. I'm the Director of Research and Network Science in the Population Health Innovation Lab, or PHIL, which is a program of the Public Health Institute. I'm also a PhD candidate in Public Affairs at the University of Colorado, Denver. And today I'm going to be recording for you all a presentation that I recently delivered at the American Public Health Association, or APHA, annual meeting. It is October 2021, and the idea here is that we in PHIL are conducting some pretty cool research, at least in my opinion, and we want to make sure that the original research that we are creating and putting out in the world is accessible to everyone, regardless of their ability to attend research conferences. And so this presentation is the same one that was delivered at APHA just a few days ago, except made available here for you all to watch at your leisure. So the study that I'll be sharing with you all in the next few minutes is called Keeping the Focus on Equity with Accountable Communities of or for Health, or ACHs, a multi-state mixed method study. This is research conducted by myself and the amazing research team in PHIL, who you see listed below at the bottom of this slide. So I want to start off today by giving a huge thanks to the people and organizations who have made this research possible. First, I want to note that funding for this project has been made available through Aligning Systems for Health, which is a national initiative led by the Georgia Health Policy Center with support from the Robert Wood Johnson Foundation. And so just a quick note there is that this study that you're watching now is a smaller part of a much larger research project that will be concluded by May of 2022. I also just want to give a huge shout out to the many organizations and individuals who have made this research possible. Perhaps top of that list is the 22 ACHs in Washington and California who are really the central focus of this study and who have made this study possible. This research would not be, it wouldn't be possible without their participation. So huge thanks to all of the ACHs who are engaged in this research. So today we'll be looking at two research questions. The first is, how are ACHs promoting equity in communities? And second, which collaborative factors are the best predictors of successful equity promotion? The overall conclusion of this study is that ACHs are building capacity for equity work that should be sustained over time to catalyze those equitable population outcomes that these ACHs are working toward. What I hope you all will get from this presentation is that you'll be able to describe 3 ways that ACHs are bringing an equity focus to communities across the states of Washington and California, and that you'll be able to identify at least one equity practice that can be applied in your own community. So let's start off with a little bit of background. First, it has become the general consensus in public health that equity is and should be a driving force. That if we are to see the types of population health improvements that we all want to see in public health, that we have to focus on equity, that this must be a central focus of our work. But what we've seen through this research is that individual communities and organizations take sometimes widely varying approaches to how they address equity in their work, or sometimes whether they address equity at all. But what we've also seen is that ACHs in many communities are equity leaders, that they are centering the conversation around equity, that they are bringing new tools and resources and ideas to communities. And they are keeping this focus on equity in a way that in many of these communities, it didn't exist before the ACH came along. And so this is what inspired the topic of this presentation and this study. So first, let's do a quick overview of the study population, which includes 22 ACHs in Washington and California. So this is all of these ACHs in those two states. And I think it's helpful to kind of frame what this model means, what this ACH model means. Because as you'll see in the graphic on the left-hand side, equity is at the center of how ACHs are conceived. So figure 1 here on the left-hand side, you'll see provides an overview of the essential elements of ACHs as defined by the Funders Forum on Accountable Health. You'll see here, there are 8 essential elements to the ACH model. These include shared vision, sustainability, governance, community partnerships, data systems, a portfolio of interventions, leadership, and continuous learning. But the other element is equity, which, as you can see in this graphic on the left, equity spans across the elements and it moves up and down throughout the entire model. And so in this way, equity is built into the ACH model, into the way that these ACHs think and work. I do want to note that this has evolved over time and that it's different in each state and even in each ACH. Every ACH is different. But I can tell you that every ACH has a focus on equity in some way, and that while the process of getting there might look different in each community, and the process of adopting this equity focus in different states might have looked a little bit different, what we've seen through this research is that equity is a central component of ACHs and how they work on the ground. So let's do a quick overview of methods before we hop into what we learned. So first, the sample includes all 22 ACHs in Washington and California. There are 9 in Washington and 13 in California. We've heard from 642 unique individuals for this study. Many of those individuals we've heard from in more than one way. Data draw on interviews and focus groups, as well as survey responses and archival records. And analysis uses descriptive statistics, multiple regression, classical content analysis, and constant comparison analysis. I think it's also really important to make sure it's clear who is represented in this study. So in the upper left-hand corner of this slide, you'll see an overview of group representation. And here you'll see that results are most representative of people who work in the social services sector, the healthcare sector, and also those who are representing ACHs or ACH staff. Moving to the right, you'll see that we have a pretty equal distribution between residential settings, where about an equal proportion of people who responded lived in an urban setting, a rural setting, or a suburban setting, with a handful of people living on reservations. Now moving to the bottom row, where we look at race and ethnicity, we see that the majority of respondents identified as white and non-Hispanic or Latina. However, we did hear from a sizable number of individuals who are either who identify as Hispanic, Latino, or Spanish, and also many others who identified as Native Hawaiian, Pacific Islander, American Indian, Alaska Native, Asian, Black or African American, or some other race. So now let's hop into our high-level result, which is that so many people, so the majority of survey takers who responded to this question, 90% of people said that they believe their ACH was effectively promoting equity across their community. So 90% of survey respondents either strongly agreed or somewhat agreed with this statement. So now let's take a look at how ACHs are doing this. What does it look like on the ground when we say that ACHs are promoting equity in communities? Well, first, we see that ACHs are building networks that open doors to equity conversations. And so what this means is that ACHs are bringing tribal nations and tribal services into conversations where oftentimes these representatives were not at the table before the ACH was intentional about bringing them into the conversation. We also see that ACHs are bringing different sectors together that may not have been meaningfully working together before the ACH was doing this convening work. We see this specifically with getting like small community-based organizations at the same table as huge health plans or health systems and sharing decision-making power across those sectors. We also see that ACHs have been instrumental in helping to build relationships across geographic boundaries. For example, some ACHs in Washington state work in multiple counties across large regions. And in this way, they are bringing small rural counties to the same decision-making tables with organizations that work in large urban hubs. And so they are helping to bridge these geographic divides that previously might not have had a whole lot of relationship going on between those areas. Second, we've seen that many ACHs are facilitating trainings and other learning opportunities about equity. And in this way, they are growing a common language around equity, around systemic racism, so that they can have these hard conversations. So one example of this is that in one ACH, we've seen that the board of directors decided that they wanted to start a book club. And so this board identifies an equity-focused book that they read together and they process together. And in this way, they learn individually and collectively and are advancing equity within their own practice so that they can be better about advancing equity within their organizations outside of the ACH and within their broad community. Next, we've seen that ACHs are enabling a focus on equity work through agreements or contract requirements with their partner organizations. So in ACHs, not every ACH has, say, contracted partners, but most ACHs have some sort of formal agreement with their partner organizations. And what we've seen is that these ACHs have leveraged the administrative tool of contracting or agreements to build equity into the work. So for example, we've seen that in areas where organizations are contracted partners or have agreements in place, ACHs have asked their partner organizations to participate in equity trainings and have built that into the agreement mechanism. We've seen that for ACHs that have organizations that report back to the ACH in some way through a work plan, that some of these ACHs are integrating equity measures into those work plans. And finally, we've seen that for ACHs that provide some sort of funding to their community, that oftentimes they will provide reimbursement based on equity achievement for that work that was funded. So next, we've seen this kind of advocate role being played by ACHs in a really accountable sort of sense. So we've seen ACHs serving as an equity watchdog or agitator in many communities, that they work hard to gather community support and to advocate for equity efforts in their communities. And again, this is oftentimes being done in a way that was not previously being done before the ACH took on this role in the community. And then finally, we've seen that ACHs are bringing new ideas to community conversations. One idea that we've seen to be particularly useful is the idea of targeted universalism. So if you're not familiar with this idea, please go check it out. We've seen several ACHs have great success with using this framework as a way to think about equity in their community. So next, let's take a look at which collaborative factors are the best predictors of effective equity promotion in ACHs. And so this question came about because as we were looking across these 22 ACHs and just looking at the amazing work that's happening, we thought, wouldn't it be cool to see, based on our survey results that look at collaboration dynamics as they relate to outcomes, wouldn't it be cool to use those survey data to see if there are specific predictors of what can kind of help us predict whether or not an ACH is going to be really excelling in this equity promotion function that we're talking about today. So what we saw is that there are 4 top predictors of the extent to which an equity or an ACH is effectively promoting equity across their community. The first 2 have to do with looking internal to the ACH and looking at their own equity practices and perceptions. So the first survey item that is a significant positive predictor of the extent to which an ACH is effectively promoting equity in their community is the extent to which the ACH applies principles of equity, diversity, and inclusion throughout its own work. So how I interpret this is, if an ACH is effectively applying equity within their own collaborative, that they are more likely to be perceived as effectively promoting equity in the community. Now, the second survey item also has to do with kind of internal equity perceptions, but this one's a little bit different in that it speaks to the importance of ACH participants believing that equity is an important focus of the ACH. So we saw here that with this survey item, that the extent to which people believed that improving health equity is an important outcome of the ACH, that this was a positive predictor of promoting equity in the community. And so here, there's that relationship between believing it's important and then seeing it be done well and seeing it be done effectively. Next, we see that this kind of broad item related to overall effectiveness is super important when it comes to effectiveness with promoting equity. And so here we saw that as a whole, that ACH gets things done. As people responded positively to that question, they also responded positively to the extent to which the ACH was effectively promoting equity in the community. And finally, we saw that reliability or perceived reliability of other participants was a positive predictor of the extent to which survey respondents believed that the ACH was effectively promoting equity across their community. So I want to close out with this wonderful quote from an ACH representative in Washington that I think does a great job of exemplifying the focus on equity in many ACHs and how this is really pretty radical in some communities. So here we heard that this time, being the COVID-19 pandemic, has highlighted for a lot of people the fact that you cannot continue to think of equity or any form of injustice as side work. If you work with community and you aren't actively engaging in an equity journey and building up mechanisms to challenge yourself and how the set of experiences you've had may be influencing your behavior, then you are causing harm in your role. So this quote, I think, just does a fabulous job of demonstrating how ACHs are really keeping the focus on equity in their communities. So in conclusion, we've seen through this research that ACHs are devoting resources and building equity into how organizations collaborate across boundaries. That this has increased attention, and that this is a first step toward improving equity outcomes at the population level. And so our emerging conclusion in Phil, which we will continue to develop as research progresses, but at this point in time, what we're thinking is that it will be critical to sustain these equity-related efforts in the long term so that equitable processes have time to translate to equitable population health outcomes. Thank you all so very much for tuning in to this virtual presentation of an APHA presentation. I hope that you found some value in the research that I've shared with you here today. If you have any questions or are interested in learning more about our aligning systems for health research as it is developing, please feel free to reach out to me. And then finally, I just want to point your attention to the amazing toolbox that we have in Phil. Here you see just some of the resources that we have available free of charge to you all. Please go to Phil's website, www.pophealthinnovationlab.org, and check out the resources page for many other tools that are readily available for you to access and use. Thank you all so much for tuning in. I hope to stay in touch with you.